Hello, I'm Todd Didier, Communications Director at the Primary Care Collaborative. Every month, the PCC recognizes outstanding leaders who are committed to improving our nation's health by strengthening primary care. This month, we're thrilled to recognize Dr. Ashraf Affan, the chairman of Angel Kids Pediatrics. Dr. Affan is an entrepreneurial innovator who has been disrupting healthcare for more than 30 years, with extensive experience in healthcare transformation and clinical optimization. As a leading expert in digital health implementation, change enablement, and healthcare operational excellence in Florida, he's developed one of the largest pediatric practices in Northeast Florida. Dr. Affan, welcome.
Thank you, Todd.
Well, we are thrilled to have you here, and we are thrilled to have you as a primary care champion. Why don't we go ahead, jump on into the first question, and how did you become a primary care champion, and why are you passionate about strengthening high-quality whole person primary care?
Okay, Todd. So I became very, very interested in primary care, if I would, accept the word champion, through my unwavering commitment to providing comprehensive, patient-centric, and later on a family-centric primary care, focusing on underserved kids and their families. My journey began with a deep realization that primary care is the backbone of health care in any society. Over the years, I have witnessed firsthand how early intervention, prevention, and screening would really improve the outcome when it comes to kids and their families, especially with integrating the behavioral health into the primary care that we are doing. I'm very passionate about strengthening the whole, primary care and in a family approach, because it's the most effective way to improve health outcome and reduce disparities. So what we do at Angel Kids Pediatrics here, we go beyond treating illness. We are not just interested in seeing those kids inside the walls in the clinics. We go to the community, we interface with other community organizations that have the same goals and mandates at what we do at Angel Kids Pediatrics, and we work that out. My drive stems from the belief that every child deserves equitable access to quality of healthcare, regardless of their socioeconomic status.
You run an independent practice that has obviously maintained a strong commitment to providing care to underserved populations. How are you able to follow through on that commitment while also ensuring that your practice remains financially viable?
This is really a very important point, Todd. In our state of Florida here, 55% of kids are on Medicaid, and I think this could be matching what the national level is. So we had to be innovative to be able to work in this environment and yet stay independent in our practice. We were able to, I think it was partly a challenge on our side that, like, hey, we want to stay independent, we want to give the same care for those patients, but yet there are all those financial challenges, administrative challenges, and the environment is keep moving every day. So we wanted to make sure that, we are viable and we still can provide high quality, accessible care to our Medicaid patients or, the underserved population. So we did this through some key strategies that we were able to embrace in our practice. The very important one is being on a value-based and taking risk with payers. That puts some accountability on our side, that we see what the outcome, we literally enjoy doing this work. When you understand the outcome, the community that we are serving, and how many families we were able to help them with, different issues that they might be going through, and how much we reduced unnecessarily or preventable ER visits. So embracing that value, care model was our first key strategy to be able to not only survive, but to excel as well as an independent practice. The second part, or the second pillar of this, is integrating behavioral health into our primary care. We can talk till tomorrow about, mental health, especially among kids, and behavioral health. And this is a key component for success, that when a family comes to our practice, in the past, we used to suffer and struggle to find some referrals for those kids. Now, within one, if we call it one-stop shop, or we call it like, turnkey services for everything those kids might need. So we do this. That was another thing. Also, we leverage technology. You can't, in today's world, you cannot live without technology. We interface with too many community organizations, because we don't just do the behavioral health and the primary medical issues for those kids, but we address their social needs, and we cannot do it. Remember, we are just a pediatric practice, right? So we have to rely and depend on, almost in our case, 150 community organizations that are our partners. They do the same work, from housing to domestic violence to helping those families finding jobs. So we really leverage the technology in what we call patient intake platforms, or patient engagement platforms, that interface with all those organizations to make sure the process of referral and the follow-ups, to make sure also those families have addressed their needs.
I want to pick up another thread that you mentioned there. You're working with a lot of partners. You're obviously in risk-based value based agreements. With a lot of these different partnerships, with those kinds of agreements, with being in Medicaid, there tends to be a lot of administrative burden, right? There's a lot of challenges in making sure that you're honoring all those agreements, that you're filling out all the necessary paperwork, proving all the proof points, while also still really making sure you're capturing the data you need to manage your patients correctly, right? To help your patients manage their care. So kind of thinking about that, thinking about the huge challenge that administrative work places on practices. Can you tell how you've kind of overcome those hurdles in your own practice, and what types of tools or technology you found helpful navigating those challenges?
Administrative burdens have become one of the biggest threats to the sustainability of not only independent practices, but probably the healthcare system in general. You can go from a small rural clinic all the way to a big hospital, and they will share with you the same issues: excessive documentation, prior authorization, compliance requirements. They just take a valuable time that we could have put back to patients' care. But now we are really managing papers. We are doing, a lot of work because of all those compliance issues. What we did at Angel Kids Pediatrics, I think a lot of people would have, said the same, that we have to find ways in innovating. Like, for example, in our case, I was talking about patient engagement platform. We automate as much as we can in the process. By having that engagement platform with patients, it will allow us to understand what the needs for those patients, whether it's housing, whether it's food, immediately through our family navigator. She will communicate with all the community partners who are interfacing through different technologies as well. And that will streamline the process of referral and making sure those needs are met for those patients.
So you've obviously made a lot of progress in this space and are doing a great job managing what administrative challenges you have. If you could eliminate or fix some part of this administrative work, what would you prioritize?
Yes, Todd, and there are many of them. But if you want me to prioritize one, or eliminating one major administrative challenge, it would be the burdensome of prior authorization process. This is really a time and effort, consuming, just to obtain insurance approval for any necessary treatment that I know for sure I'm going to need to do. It's just wasting time. It creates unnecessary delay in patient care and place a financial strain on the healthcare entity or the practice. And just simplifying that process or eliminating it altogether is really going to be of help.
Let's pull back a little bit, look at the health system a little bit more broadly, particularly through the lens of primary care and pediatric care. If you could emphasize one major message to policymakers, thought leaders, other experts in this area, what would it be? What is one major issue you'd like to see leaders address?
with no hesitation is going to be integrating mental and behavioral health into primary care and ensure access, universal access for all children, especially those on Medicaid or in underserved areas. The mental health crisis, Todd, has become, especially among kids, it's reaching a level that's so alarming to all of us. Yet access of care remains fragmented. Like, it's not unusual to hear that to get access uh, um, to mental health or behavioral health, you might need to wait for 2 years or 3 years, or sometimes there is no access for you if you are on Medicaid. So this is really, if we are embedding mental health services into primary care as a standard practice, we can prevent crisis, we reduce emergency room visits, and provide early intervention that change lives. At Angel Kids Pediatrics, because we have been taking risk with payers, we noticed over the last 3, 4 years, especially after the pandemic, that most of our cost for inpatients as well as emergency department cost for our patients is stemming out of mental health diseases. Those would be $10,000 and more. Those kids are going to the ED, emergency department, or being admitted, not for medical issues, it's for mental issues. So this how alarming and how costly this is. If we can prevent this and we can provide services at the primary care level, it's no brainer that we can prevent consequences of those mental issues.
Wrapping us up here, we've talked a lot about concrete things that Angel Kids has done and some concrete solutions that folks can propose to affect things right now. But let's go a level higher. Let's say you have a magic wand. You can just change one thing about the American healthcare system overnight. You don't have to worry about politics or industry or anything like that. You can just change whatever you want. What would it be?
As I mentioned, I think integrating behavioral health into primary care, this is really very important for us, as well as finding ways to spread and scale the value-based care. This is something very important. There is another thing, I think, the primary care collaborative, and I'm very glad to be part of your esteemed organization, the PCC, the advocacy that PCC is giving towards primary care, and explain how 52% of the visits that are happening in our healthcare system annually are happening in a primary care settings. Yet we are just funded by less than 6%. I think the last report I saw was like 5.2% that allocated to primary care. When you go to other industrial countries, you'll see that ratio is going up to like 9, 10, 12, and you're going to see the outcome of healthcare when it comes to longevity, maternal health, childhood mortalities, chronic disease management, like healthier communities when you advocate and you put more money towards primary care. I think this is really very important. I would augment and echo on the message of the Primary Care Collaborative in all settings to make sure all our politicians and policymakers are aware that the investment in primary care is the only investment that can yield sixfold, 600% when you do it. There is no investment in Wall Street that will bring you, sixfolds when you put a dollar sign next to it.
Well, thank you so much for joining us today, Dr. Affan. And we are so grateful to have you in our membership, and grateful for the wonderful work that you're doing down in Florida.
And thank you, Todd, and thanks for everyone at the PCC and all people who are really working day and night, producing all those reports, collecting data, and work on our behalf as a primary care pediatrician, as a primary care doctor. We really saw how your work, for years, and especially after the pandemic, has been helping us to stabilize the primary care in the USA. And I think a lot of good stuff to come. So I would, always be here to help in any capacity that we can do to advance primary care. Thank you.